Welcome to the Get to Know Medicare and Medicare Made Clear educational seminar. My name is Ken Woods, and I'm the Managing Director of Dublin Health and Benefit Group, located on Main Street in Dublin, New Hampshire. For 35 years, I've been an independent broker in the Medicare and health insurance markets. I lead a team of 12 employees who are all here to assist those needing to learn about Medicare, as well as the healthcare.gov marketplace. We serve clients all over New Hampshire, as well as Maine, Vermont, Massachusetts, and Florida. Our focus is educating and enrollment assistance for many thousands of clients in these markets. Today, our focus is Medicare. There are significant changes to products, carriers, and costs for 2025 due to the Inflation Reduction Act. So we encourage you to pay special attention this year, as many will be affected and will want to make an informed decision in this particularly impactful year. Before we do, I'd like you to know how you can reach out for additional information. Our website is at dublinhealth.net, and our phone number is 603-563-8820. Nobody describes better the experience of working with Dublin Health and Benefit than our brokers and our clients. Let's listen to what they have to say. So I'll share my screen with you and begin by bringing you over to the Dublin Health website at dublinhealth.net. I'd encourage you to go out to learn more about our organization. The headings tell it all. We have our team listed here, the services that we provide, what we do for employer groups, and as is the case for today, what we do for individuals and Medicare clients. Our contact information is here, and this is just an introduction from our staff and some of our clients and what their experience has been like over the years as they've engaged Dublin Health and Benefit Group.
If I had to describe my experience with Dublin Health and Benefit in one word, it'd probably be thankful.
Relief.
Satisfying.
Competent caring. Competence and caring combined.
Personal. Commitment. Expertise.
I've had a positive experience interacting with everyone at Dublin Health. My main contact was Mike. To have somebody with that expertise who does it for a lot of people in New Hampshire, knows all the plans quite intimately. I mean, down to the fact, would my doctor be able to be paid by this particular provider? Yeah, that made me very thankful.
It doesn't cost the client anything to work with Dublin Health and Benefit. We get paid by insurers when we place the business with a carrier. We get paid the same no matter what carrier we work with, so we don't have a horse in this race.
My experience with the staff at Dublin Health started out just with Ken, the owner. In terms of his capability and his expertise, I really lean on that for him. And then as Dublin Health and Benefits grew, I'd call and other people would be answering the phone, and they were as warm and personable and were able to understand me as quickly as Ken, the owner, did in the beginning. So it's just, I don't know how he does it, but they all kind of feel like a family. They're with the same kind of values and the same way of communicating. And I know that they are looking out for me, and I've never been disappointed. I've never had a complaint in 15 years. I'm always thrilled and amazed.
I love what I do. Take joy and pleasure in the service of others, helping them come to an aha moment about what's the right decision for them. That's why I can repeatedly do the same thing over and over with thousands and thousands of clients, because we love to help people and serve people. We love to see the joy on their face, the relief.
Working with Colleen has been one of the best things we have ever done for ourselves and for our security for the rest of our life. She asked us a few questions over the phone, took information from us, and then she just ran with all of that, did all of the research. We came in here one time.
Yeah, when we first stepped into Colleen's office, she went through each of all the plans, told us which ones she thought was best for us, considering, who our doctors are and our medications. So, she just took all this and narrowed it down to this.
When you find an insurance solution for someone, that's a professional achievement, an accomplishment, and that in itself is rewarding. But when you look at the person as an individual and you've helped find a solution that suits them, that's personally rewarding, and that's really what drives me as an agent. I'm more into the solution for the person than the insurance itself. The insurance is just the vehicle that gets them there.
The federal government allows people to be on their parents' insurance until they're 26. Sometimes that's not advantageous for them, though, and that's a place where we can help them then be able to move on to their own health care that fits their life and their style.
So it's important whether you're 26 or 110 that you have health insurance.
I would absolutely refer people to Dublin Health and Benefit. In fact, I already have.
I think I must have referred at least a dozen people, and they continually tell me what to find.
We have actually already referred some people to Dublin Health and Benefit, and we will continue to do that.
The Monadnock region is known for its natural beauty, for hills and streams, lakes, miles of forest, and of course Mount Monadnock. We're also known for having the best insurance agency in New Hampshire, Dublin Health and Benefit.
So let's get right into 2024 and some updates on what's changing for 2025 in Medicare. First, let me begin by saying this is an educational format. There are no specific products or carriers being brought to the discussion. It's generic concepts to help you understand the various components that make up a Medicare program. And while the United Healthcare label is here because they assembled what CMS considers to be a compliant educational discussion about Medicare, it is not proprietary to United Healthcare products as we go through this. We're going to look at the top 10 Medicare questions. What is Medicare? Who can get Medicare? Do I need Medicare if I plan to work past 65? What does Medicare cover? Where can I get more coverage? What does Medicare cost? How do I choose Medicare coverage? When can I enroll? When can I change my coverage? And how can I save money? This course is appropriate for those who are aging in within the next 2 years and want to understand the basic components of Medicare. It's also a great refresher for those who are existing Medicare beneficiaries who want to understand the entire landscape once again and revisit some of the decisions that you may have made in the past as compared to what you might do in this upcoming annual election period. So to begin with, what is Medicare? Medicare is a federal health insurance program for eligible U.S. citizens and legal residents. It's funded in part by the taxes you pay while you're working. It is individual health insurance. Medicare is not free. It's not a family health plan. It's not Social Security, nor is it Medicaid. What is Medicaid? A state government program that helps pay health care costs for individuals, families, and children with income and resources, with limited income and resources, rather. Programs vary from state to state, but do follow federal guidelines for benefits. Eligibility varies from state to state. Medicare and Medicaid can work together. This is known as dual eligibility. Who can get Medicare? U.S. citizens and legal residents. Legal residents must live in the U.S. for at least 5 years in a row, including the 5 years just before applying for Medicare. You must also meet one of the following requirements: age 65 or older, younger than 65 with a qualifying disability, or any age with a diagnosis of end-stage renal disease or ALS, also known as Lou Gehrig's disease. Can you have both Medicare and Medicaid? Yes, of course. Some people are eligible for both Medicare and Medicaid. We call this dual eligibility. Medicare and Medicaid can work together for your healthcare costs. You may qualify for special Medicare plans. Do I need Medicare if I plan to work past age 65? This is a key question for many of us who are continuing beyond 65 and are on a creditable plan through an employer group. We call these folks working aged. Your Medicare enrollment options when working past 65 may be different. You may be able to delay, or you may have to enroll at age 65. Here are the criteria for which path applies to you. Generally, you can delay Medicare past 65 without penalty if the employer group has 20 or more employees. The employer health coverage is considered creditable. These are groups that are known as COBRA compliant, over 20 employees, with a plan that is at least as good as Medicare, also known as creditable. If you work for a smaller group, you'll need to enroll at age 65 if your employer has fewer than 20 employees, or your coverage is not considered creditable. Often you can find in the employee handbook or go to the HR department to assure yourself that a plan is creditable or not. What if I'm covered by my spouse's employer? You may be able to delay your employer-based health coverage through your spouse. You may have to enroll. It depends on the spouse's employer and any rules the employer has around covered dependents. Getting Medicare while still working. Medicare and your employer insurance can work together. If you take any part of Medicare, you will no longer be able to contribute to an HSA or health savings account. So it's imperative, if you're wanting to continue funding an HSA as a working aged, you should not sign up for any part of A or B as long as you have a creditable plan through an employer with more than 20 employees. Medicare will not cover anyone but you, so consider how any dependents will be covered. This is where we can step in. Many people, as they age into Medicare, want to retire, have a spouse that is not yet eligible for Medicare and needs to bridge a gap between their younger age and their initial eligibility into Medicare. We can help your spouse evaluate whether a COBRA option through the employer group is sufficient or the best value. We can also look at healthcare.gov and see if perhaps we might be able to achieve some form of a tax credit based on income eligibility that would enable you to go off and retire and still offer a spouse and perhaps dependent children under age 26 access to coverage, either through COBRA or through healthcare.gov, and we can assist you with that. What does Medicare cover? Original Medicare has two parts. Part A, hospital insurance, helps pay for hospital and inpatient care. Part B, medical insurance, helps pay for doctor and outpatient care. Medicare Part A covers hospital stays and inpatient care, including your hospital room and meals, care in special units such as intensive care, prescription drugs and medical supplies used during an inpatient stay, lab tests, x-rays, medical equipment as an inpatient, operating room and recovery room services, skilled nursing services, some blood transfusions, hospice care, including medications to maintain or manage symptoms and pain, part-time skilled care for the homebound after a qualified inpatient stay, rehabilitation services after a qualified inpatient stay. Some fast facts as it pertains to Part A hospital insurance. Premium free if you are or your spouse worked and paid taxes for 10 years or longer. Can't be denied coverage. Coverage is nationwide, including any qualified hospital in the US. Coverage and costs are per benefit, period. Must be admitted as an inpatient, not on an observation status. Provides lifetime reserve days, 60 of them. Medicare Part B, medical insurance. Medicare Part B covers doctor visits and outpatient care, including doctor visits when you're in the hospital, an annual wellness visit, and preventive services like flu shots, clinical lab services like blood and urine tests, x-rays, MRIs, CAT scans, EKGs, and some other diagnostic tests. Some health programs like smoking cessation and obesity counseling are covered under Part B. Physical therapy, occupational therapy, speech and language pathology services are all covered under skilled care. Diabetes screenings, education, and certain supplies, mental health care, durable medical equipment for use at home like wheelchairs, walkers, canes, sleep apnea machines, beds, ambulatory surgical center services where you might have a procedure where you're not admitted overnight, you're released same day. Telehealth visits are not for use in emergencies. Not all providers offer virtual care, but if they do, they are covered under Part B. Some fast facts. There is a monthly premium adjusted for income in 2024 for most Americans earning less than $103,000 as an individual or $206,000 as a married couple filing jointly. You'll pay $174.70 per month for Part B. You cannot be denied coverage. Coverage is nationwide, including any provider who accepts Medicare. Premium penalty for late enrollment unless you qualify for a special enrollment period. Medicare doesn't cover everything. Original Medicare Parts A and B does not cover all of the cost of your care. You have out-of-pocket costs with no limit. Prescription drugs are not covered under Original Medicare. Routine dental, vision, or hearing care, eyeglasses, contacts, hearing aids, long-term care or custodial care. Most of us know that as nursing home type care, help with bathing, eating, dressing. The activities of daily living are not covered in a custodial manner. Excess charges for services by doctors who don't accept Medicare assignment are not covered by Medicare, and care received outside the US except for certain circumstances. Where can I get more coverage? Options for more coverage. Basically everything that you see on TV or in the newspaper or advertising, filling up your mailbox for many of you aging into Medicare, are solicitations for additional coverage to complement Original Medicare. And all of those products that you may be seeing are going to fall into option 1 or option 2. Option 1, you can add one or both of these following to Original Medicare. Medicare Part D plan offered by private insurance companies helps pay for prescription drugs, and Medicare supplement insurance, also known as Medigap coverage, offered by private insurance companies as well. These plans help pay some or all of the out-of-pocket costs not paid by Original Medicare. Or option 2, you could choose a Medicare Advantage plan. Medicare Advantage, also known as Part C, offered by private insurance companies. It combines Part A and Part B in one plan. Usually, it embeds or includes prescription drug coverage, and it may offer additional benefits like vision and dental coverages. Part C, Medicare Advantage, is another way to get your Medicare benefits. An alternative to original Medicare Parts A and B, plan members are still in the Medicare program. Benefits are administered by the plan. Plans are offered by private insurance companies. Most plans offer built-in prescription drug coverage. Plans may also offer additional health benefits such as dental, vision, and fitness benefits. All Medicare Advantage plans cover all the benefits of Part A except hospice care, which is still covered by Part A. All the benefits of Part B, and most Medicare Advantage plans cover prescription drugs embedded right into the product. Medicare Advantage plans may also offer additional benefits and features, such as dental exams, cleanings and x-rays, eye exams, eyeglasses and contacts, hearing tests and hearing aids, fitness programs, and memberships. Part C, Medicare Advantage plan types. There are a number of different types of these Part C plans. Coordinated care plans include Health Maintenance Organization, or HMO, point of service plans, POS, preferred provider organization plans, known as PPOs, special needs plans, dual special needs plans, Medicare, Medicaid eligible have special plans available. Some states offer chronic special needs plans. If you have a respiratory or a diabetic condition or some special need, there are states that offer what are known as SNAP plans, institutional special needs plans for those who may need long-term custodial care. Institutional equivalent special needs plans, i.e. SNAP. Other plan types are private fee-for-service plans and medical savings account plans. These are all forms of Part C Medicare Advantage. Some fast facts about these plans: must be enrolled in both Medicare Part A and Part B and live in planned service area. You cannot be denied based on current financial or health status, including pre-existing conditions. You may be required to use provider and pharmacy networks. Coverage and costs vary by plan and may change each year. Annual limit on out-of-pocket costs for covered services. May charge a monthly plan premium. Must continue to pay Part B premium to Medicare. Medicare Part D insurance provides coverage for prescription drugs and some vaccines. There are two ways to get coverage. You can get a standalone Part D plan or a Medicare Advantage plan that includes prescription drug coverage. Medicare Part D plans cover types of drugs most commonly prescribed for Medicare beneficiaries as determined by federal standards. Specific brand name drugs and generic drugs included in the drug list, also known as a formulary. They are commercial. They also cover commercially available vaccines not covered by Part B. An example might be the shingles shot. Part D prescription drug coverage often will work with a formulary. This is a list of prescription drug coverage, prescription drugs covered by a plan. Most have a tiered formulary. These drugs are grouped into tiers based on cost. In general, the lower the tier, the lower the cost. Deductibles may be charged by tier. Formulary tiers 1, 2, 3, 4, and 5 are common and categorized based on cost. During the year, you may go through different drug coverage stages. Here I'm going to step back and talk about what 2024 held for folks aging into Medicare. And I'm also going to detail some additional changes that are upcoming for 2025, as alluded to earlier. So there are 4 stages, and every Part D plan in 2024. The first stage is annual deductible, if any. Second stage is initial coverage. This is the first $5,030 in retail total drug costs. Third stage is the coverage gap, also known as the donut hole, where you are cost sharing and paying up to $8,000 in out-of-pocket costs. And finally, stage 4, catastrophic coverage to the end of the year. Amount paid for prescription depends on what stage you're in. Dollar limits can change each year. Not all plans have a deductible. Many people never reach the coverage gap or donut hole, which is known as stage 3. The coverage stage cycle starts over at the beginning of each plan year, usually January 1st. Now, let me step out of this discussion for a moment and talk about what we anticipate due to the legislative changes that will happen during this annual election period and apply for plans beginning January 1st of 2025. In 2025, there will be stage 1 annual deductible. There may be plans without. Then the initial coverage stage is going to be $2,000, meaning that whatever cost sharing you're paying by stage 3, you've reached the max out of pocket of $2,000 in 2025. The stage 3 coverage gap will be eliminated in 2025, so no longer will you be exposed to up to an $8,000 out-of-pocket exposure. Your max out-of-pocket in 2025 is capped at $2,000. So if you reach that $2,000 threshold, you now are in stage 3 for 2025, known as the catastrophic coverage phase, where 100% of your medically necessary medications will be covered. It's a significant deviation from what we've experienced in the past, and why it's especially important in 2025 for current Medicare beneficiaries to take a close look at their strategy going forward. And for newly eligible Medicare beneficiaries, this can be a key consideration in your decision to perhaps stop working and retire, particularly considering your personal exposure to prescription drug medication costs. I want to digress for a minute and state that we anticipate this year for 2025, this open enrollment, there are carriers that will exit this market due to the additional exposure. There are carriers that very likely will be increasing premium costs to beneficiaries, and formularies will change. It's a really good idea this year in particular, perhaps over any other I've experienced in my 35-year career, to evaluate your situation going forward into 2025, because there are a lot of moving parts here and implications that warrant your attention. Some fast facts about Part D prescription drug coverage: you must be enrolled in Medicare A, Part B, or both. You may be required to use a pharmacy network. Coverage and costs vary by plan and may change each year. Part D, premium penalty for late enrollment unless you qualify for a special enrollment period, and those penalties are applied for life. Medicare supplement insurance, or Medigap policy. This is an alternative path to the Medicare Advantage Part C. These plans help pay some of the out-of-pocket costs not paid by Medicare Parts A and B. It works with original Medicare Parts A and B and Medicare Part D. Can't be used to pay for Medicare Advantage costs. There are 10 plans standardized by federal and state law. Plans are labeled by letters, Plan A, Plan G, as an example, and what costs and services are covered vary by plan. Plans with the same letter offer the same basic benefits nationwide. The exceptions to those rules are Massachusetts, Minnesota, and Wisconsin that standardize plans differently, although similarly, but there are definite differences we can help you understand. Plans are offered by private insurance companies in your state. Medicare Supplement Insurance Medigap policies may help pay Part A hospital coinsurance, Part A skilled nursing care coinsurance, Part B coinsurance or copays, cost of blood transfusions, the first 3 pints, cost of 365 extra hospital days that are not covered by original Medicare, hospice care coinsurance, Part B deductible, and Part A deductible. Foreign travel emergency care up to plan limits. Provider charges above Medicare approved amounts. Plans do not help cover in the environment we're talking about here. Medigap or supplement policies do not cover prescription drugs, routine dental, vision, or hearing, eyeglasses, contacts, hearing aids, custodial care, which is nursing home type care, helping with activities of daily living. Long-term care is not covered by Medicare supplement insurance. These are the standardized Medicare supplement plans, and it entails an outline of the differences between plans A to N, which are available to all people aging into Medicare for the first time after January 1st of 2020. A couple of older grandfathered plans are still available to those working agents who may have been on a creditable group plan and are now going off into retirement, having aged into Medicare prior to January 1st of 2020. You have access to not only the first series of plans, in addition, you could access the 2 grandfathered plans no longer available to those aging in after January 1st. So if you are aging in prior to January 1st, 2020, and perhaps you've been on a creditable group plan for a number of years and you're now going into retirement, you still have access to Plan C and Plan F. Medicare Supplement Insurance, Medigap, Fast Facts, must be enrolled in both Medicare Part A and B and live in the state where the plan is offered. No medical underwriting up to 6 months after enrolling in Part B at age 65 or older as a working aged person leaving a creditable plan. Nationwide coverage and no provider network. Any doctor or hospital anywhere in the country that accepts Medicare will accept the supplement plan. Guaranteed renewable as long as you pay your premium. Plan premiums may vary for same coverage. Plans with more coverage generally have higher premiums. Must continue to pay Part B premium to Medicare. So that's a little of where we come in assisting you, since all these plans are by design contractually identical. We help find who might bring a better value in the state you live in. So how much does Medicare cost? Medicare cost premium is a fixed amount that you pay for coverage, usually monthly. Deductible is a set amount you pay for covered services before your plan begins to pay. Co-pays are a fixed amount you pay at the time you receive a covered service. And co-insurance is an amount you pay when the plan splits the cost of coverage service with you by percentage, such as 80-20. That means that you're sharing in the cost where the carrier is paying 80% and you're paying 20%. Just some of the definitions that go along with Medicare costs. Part C, Part D, and Medigap costs. Plans will vary in the costs they choose to include and how much. Costs you could pay may include, under a Medicare Advantage, you could have a premium as low as zero cost. You would perhaps have a deductible, although some don't. You could pay some co-pays or co-insurance as you navigate access to care. Part D prescription drug plans include a monthly premium, a deductible, co-pays based on the tier of the drug that you're accessing, and perhaps co-insurance, which is a percentage or a sharing of costs. Medicare supplement insurance or Medigap policies do have a monthly premium as well. They have a deductible, and most have a deductible, and some have some co-pays or cost sharing along the way. Medicare Advantage plans have an annual out-of-pocket maximum for covered services. How do I choose? Here are the Medicare covered combinations. With original Medicare Parts A and B, looking at the left-hand column, you could simply have Part A and B. Unfortunately, that does leave you with unlimited liability. Most don't choose that. You could, next column down, or next line down, you could have original Medicare A and B and simply have a standalone prescription drug plan. You could also have original Medicare and a Medigap policy to help pay down the gaps on the health insurance side of the equation. Or you could have Parts A and B original Medicare, a separate standalone Part D prescription drug plan, as well as a Medigap policy to help pay for the cost sharing associated with original Medicare. Under Medicare Advantage Part C, you could simply have Part C, which may embed a standalone prescription or not. You could have Part C with a Part D plan. You could have Part C plus a standalone Part D. So, Medicare coverage choices. What are the steps involved? Step 1, enroll in original Medicare. That's Parts A and B. Step 2, decide if you need additional coverage. There are 2 ways to get it. You recall option 1. You can add one or both of the following to original Medicare. You can add a Part D plan, standalone, and you can add a Medicare supplement plan to backfill the gaps in original Medicare. Or option 2, you could choose a Medicare Advantage plan, which is Part C, combines Part A and B in one plan, usually includes prescription drug coverage, and it often provides additional benefits and services, programs not provided by original Medicare, like dental, vision, hearing, and so forth. You could also choose to do nothing and just sign up for original Medicare Part A and B, although again, there is no ceiling or cap to the max out of pocket on original Medicare only. Medigap or Medicare Advantage. Let's look at the considerations. Coverage. Medigap pays some costs not paid by original Medicare, does not help with drug costs, has nationwide coverage and access, may offer additional value-added services like a gym membership reimbursement. Medicare Advantage provides benefits of original Medicare and beyond, often includes Part D prescription drug coverage, may have a provider network, and may offer additional health benefits like dental, vision, and hearing. Cost. A Medigap plan would have a monthly plan premium, drug plan premium, and other costs if you also add a standalone Part D plan. And you have some out-of-pocket costs depending on the plan chosen. A Medicare Advantage plan may charge a plan premium, often no additional premium for drug coverage, co-pays or co-insurance for most covered services, and an annual out-of-pocket maximum. Convenience. Multiple plans when added to original Medicare along with a Part D plan. Medicare Advantage is often an all-in-one plan. When can I enroll? You have an initial enrollment period. That's the 3 months before you turn 65, the month you turn, and 3 months after. You'll be enrolled automatically if you're receiving a Social Security or Railroad Retirement Board benefit at age 65, or after receiving Social Security disability benefits for 24 months. You must enroll yourself if not receiving benefits. You should go to ssa.gov/benefits, Medicare to enroll online. Medicare Advantage Plan Part C and D, you need to enroll directly with the plan provider. We can assist you with that at Dublin Health and Benefit. Tips: enroll early to avoid gaps in coverage and late enrollment penalties. May refuse or delay enrollment in Part B with creditable employer coverage. So that's a consideration. If you're considering being a working agent and you have deeper, broader questions about your particular situation, we can help you often years before you move on to Medicare. You can call our office and we'll guide you. General enrollment period is January, February, March, April, May, and June. Parts A and B for January to March, and parts C and D, April to June. For those who miss their initial enrollment period, you may enroll in Part A and B or both. You may choose to enroll in a Medicare Advantage plan, Part C, or a prescription drug plan. Late enrollment premium penalties may apply if you did not have creditable prior coverage. Medicare Supplement open enrollment period is age 65 or older and enrolled in Medicare Parts A and B. It lasts for 6 months, beginning with the month in which you are 65 or older and enrolled in both Medicare A and B. No medical underwriting if you enroll during this 6-month period. You may apply at other times, but you could be denied coverage or charged a higher premium based on your health history. Some states may have additional open enrollment rights under state law. Special enrollment period for people working past 65. The last month of employment or employee health coverage, you have an 8-month window to sign up for parts A and B. Part C and D for those who delayed enrollment with creditable employer health coverage. You will have 8 months to enroll in Part A, Part B, or both. You will have only 2 months, and this is critical to understand if you're going to be choosing the Advantage path. If you're leaving an employer group plan, you do not get the full 8 months. You will have only the first 2 months to enroll in a Medicare Advantage Part C or Part D prescription drug plan. You have exactly 63 days to get a standalone Part D plan or Medicare Advantage plan with prescription drug coverage without penalty. Late enrollment premium penalties for Medicare Part A, none if qualified for premium free. The penalty is 10% of the Part A premium if you have a premium. Medicare Parts B, none if qualified for a special enrollment period, like a working agent leaving a qualified plan. The penalty is 10% of the monthly Part B premium amount for each full 12-month period enrollment is delayed and you've not had creditable prior coverage. And this is a penalty that happens every year for life. Medicare Part D, none if less than 63 days without creditable coverage. The penalty is an additional 1% of the average Part D premium for each month you delayed enrollment. And it's based on the average of the government business model amount, which in 2024 is about $34. It's 1% of $34 for every month you've been uninsured under a Part D plan and had not carried creditable coverage through an employer group. So for example, if you're 10 years out of coverage with no creditable coverage through an employer, you could pay 1% times 120 months or 120% of the 2024 average of about $34. And that penalty would be for life as well. So we always encourage people to maintain Part D coverage. Even if you're not taking medications, we can get you a reasonably inexpensive plan. When can I change my coverage? Medicare annual enrollment period, also known as the AEP or the OEP, and that's October 15th to December 7th of each year. You can join, switch, or drop Medicare Advantage Part C or Medicare Part D prescription plan. You can switch from original Medicare A and B to a Medicare Advantage plan or vice versa. You can switch from one Advantage plan to another. The next one is Medicare open enrollment period, January, February, and March of the following year. Available to Medicare Advantage plan members only. They can switch to different Medicare Advantage plan or return to original Medicare Parts A and B. They can also enroll in a standalone Part D prescription plan if returning to original Medicare. Just one coverage change is allowed. Special enrollment period, the month you have a qualifying event. In most cases, you have 2 full months after the month of a qualifying event to make plan changes. During this time, you may join, change, or drop a Medicare Advantage or prescription drug plan outside of the Medicare annual enrollment period without penalty. Common events may qualify include moving, leaving, retiree union, or COBRA coverage. How can I save money? Well, certainly use your preventive services. Identify problems early. Use your plan's provider network. Make sure that who you're seeing is in network and accepting your plan. Ask about generic and low-tier prescription drug plans. Use plan's preferred pharmacy network or mail order pharmacy. And understand your status in the hospital, particularly whether you're admitted or you're simply there for observation. Financial assistance programs available to some folks based on income and situation. Extra help helps with Medicare Part D costs. Medicaid provides healthcare coverage for people and families with limited incomes, and these programs vary by state. There are also Medicare savings programs help pay Medicare Part A and Part B costs based on income. Program of all-inclusive care for the elderly, also known as PACE, provides care services for frail elderly living in the community. Where can I go for help? Well, certainly we would love to be your servicing agent in helping you navigate all of the programs that are available in your state of residence. And you can go to dublinhealth.net. You can also email us, info@dublinhealth.net. And you can call us at 603-563-8820. It's been a pleasure talking with you today. There's a reason many of the financial advisors in the area refer our agency to their clients, and we so appreciate that partnership. I look forward to hearing from all of you, and we have a great team here that can answer any questions, help educate you, help enroll you, and support you throughout the calendar year as questions come up with regard to the programs that you are enrolled in. Thank you. Have a great day.